let's talk about injectable treatments, which are super popular. We do them all the time, and they include things like Botox and fillers, and patients are getting them and sometimes are not really sure what to expect after treatment or even what to do before. So one of the concerns I hear about a lot is, am I going to have downtime? Am I going to have bruising and swelling? And I think you have to consider the fact that when we're doing injectables, we're using a needle to pierce the skin. So inevitably there is a chance of bruising, and this can happen even if you've had injectables before. You didn't bruise the first time, you might bruise the second time. More often than not, with fillers, we're going to get a little bit of bruising. This is much less common with Botox. With fillers, we're piercing the skin multiple times in different areas, and bruises do happen, and I typically tell patients that they blossom over the first couple of days. So you may leave here the day of your treatment and not see very much in the way of bruising, and then a day or two later, the bruises appear. So what can you do to minimize bruising? Well, there's a few steps both you as the patient as well as your practitioner can take. First of all, I would recommend stopping any medications or supplements that can increase your bruising risk. This includes things like aspirin, ibuprofen, and supplements like fish oil. You can get a more inclusive list really just by searching online. The other thing is, during the treatment, there's a few steps that we can take. One of them is we usually ice as the treatment is being done. And when you go home for a day or two, it's reasonable to ice your area 20 minutes on, 20 minutes off when you're able to. Let's say in the worst case scenario you do get a dark red or purple bruise. We do have a laser that we can treat that with, and it's going to break up the bruise and make it clear faster. And of course, be sure to have a really good foundation or cover-up makeup on hand, and dark lipstick if you're getting lip fillers, and that should take care of covering any bruises that do occur. Of course, there's areas of the face that tend to bruise more than others, depending on where we're injecting your fillers. So understandably, if we're injecting the under eye area for hollows, you can expect some bruising. It's a very delicate area with thin skin, and it's just something that can be expected. One of the things that I do to minimize bruising in that area is I use cannulas, which look just like a needle, but the end is blunt, and that really helps me in terms of minimizing the bruising in that area. Other areas that are very prone to bruising are lips, and again, dark lipsticks should take care of that. Now, what if you're a patient who is on blood thinners for a cardiac condition and you really can't come off them? There are instances like that where patients are taking a medication like Coumadin and really want to be able to get injectables. Well, it is possible to do that. I think that if you go into it understanding that you may have a little more bruising than the average patient, then that's an option. But also, as the practitioner, I can mix in a lidocaine solution with epinephrine, which is adrenaline. It is a medication that actually constricts blood vessels, so that as I'm placing the filler, you actually get less bruising as the blood vessels constrict. So that can be helpful, but it is an extra step that your practitioner would need to take.